I'm Nurse Emily. I'm Managing Director of Romsey Medical Practice.
Hi everyone, I'm Chris, Dr. Chris, Emily's husband and the Clinical Director of the Romsey Medical Practice. We just wanted to record this video as a little bit of an about us, not necessarily us as people, but about us as Romsey Medical Practice and where we've come from, why we've set up what we've set up and what we're hoping to achieve for our patients and the community sort of generally. How long have we been doing this for?
We started back in 2013.
What's our background?
So, Dr. Chris, you are an orthopaedic surgeon by background, and I was a consultant nurse in emergency medicine. We've both got a combined 26 years NHS experience between us.
Not that long.
Not that long. So we started doing aesthetics, medical aesthetics, back in 2013. And since then, our business has grown and we've learnt lots and developed our practice.
From the cosmetical injectable side of things, we did it alongside our NHS careers, and then one thing led to another and it kind of became our new careers. But I think one thing that the recent global pandemic has shown us is that unfortunately there is quite a struggle and quite a strain on the current systems that are in place. I think for us as well, we're fiercely proud to be a doctor and nurse and a married couple working in the field of medicine, and it sometimes gets a little bit murky in the world of facial injectables as to whether or not this is medicine or something different. I can categorically tell you that medical injectables and facial injectables is a field of medicine in its own right, but I think we wanted to have a bit more. We wanted to feel like we were working in the sphere of medicine even more, and if we could do that by offering a service while there was a need for that sort of service, it would be even better for us. So what have we set up? So
we're really excited to launch a private GP service that will be coming March 2022, and also we've got a dermatologist joining our team, again starting in March. We've also got an oculoplastic surgeon joining our team, so we're really excited that we now have collaborated with some other medical professionals, highly skilled,
highly trained, but guys that sort of fit in with our ethos and our thought process of, we want to put patients at the centre of our attention. We're very patient-centric is a phrase that we use quite a lot. I think what we've noticed is that there's a certain demographic of our local population that is somewhat falling between the gaps. As I said, systems are currently under a huge amount of stress and strain, and that's only gotten worse over the last couple of years. So there are a cohort of people out there who potentially can't get through to their regular medical practitioners, their GPs, their surgeries, and equally if they can get through, they may be struggling to get appointments on their terms and at times that suit them. So we see that and we want to help as much as we can. So at Romsey Medical Practice, we very much want to work on the basis of its medical appointments and your choice. So if you want it to be a virtual or a telephone, then by all means it can be. But we would like to be able to offer, and this is what we're planning on offering, and we will be offering face-to-face medical consultations with either the private GP, the dermatologist or the oculoplastic surgeon. With a view, or us, absolutely. With a view that you're going to get an answer to something relatively more quickly, and hopefully that level of anxiety, that level of worry, that sort of, should this be something I should be concerned about, is taken away from you, meaning you are able to then get on and spend more time at work with your family, doing things that you enjoy, as opposed to worrying about your health and your medical conditions because you're unable to access the system which is struggling at the moment. Again, we've reached out to all of our local NHS GPs to make them aware that this is what we're embarking upon. We in no way want this to be competitive with them. We are working alongside them with the view of improving the healthcare provision for the local community and the community at large.
So by all means, take a look through the rest of our website. There's lots of information on there about the services we're offering. And obviously get in touch with our front of house team should you wish to book an appointment.
Equally, if there's anything that you feel that it would be beneficial for us to be able to offer from this facility that maybe is more difficult to be offered in more traditional GP or medical practices, then by all means drop us a line as well and we can look into it, take everything on its merits. We're not going to say no to anything outright, but obviously we just need to do our due diligence on anything to see if there's any other treatments or any other services or provision that we can offer. Anyway guys, lovely to speak to you. Enjoy the rest of the website and take care. Speak to you soon.
Bye.